push like play.
Yeah, like.
Come in.
Good afternoon. How are you doing today?
Good. How are you?
Good. My name's Jenny. I'm going to be your nurse today.
Nice to meet you.
Can I ask you your name?
Stacy Johnson.
And what is your date? What is your date of birth?
It is September 7th, 1985.
Perfect. I'm going to go through your health history today. We're going to talk about why you're here and what your goals of being here are. But I need to get just a baseline of your health condition and your past medical illnesses, so that we know where to proceed from here.
Sure.
Okay. So what brings you in today?
Well, I've actually had endometriosis since I was 15. The pain has always been really bad, but just lately it's really gotten excruciating. It's a lot worse. I feel like I'm running out of options, and I'm actually considering a hysterectomy.
Okay, well that's definitely something that we can talk about today. We'll talk about the advantages and disadvantages of having that.
Sure.
But first, let's just get that baseline like I talked about. It takes about 15 minutes to go through.
Okay.
Okay? Do you have any allergies to any food or medications?
No.
No. And do you have any religious preferences?
No.
No. Do you have any spirituality concerns that would affect your health care?
No.
What what ethnicity do you identify yourself as?
Caucasian.
Caucasian.
Yes.
What would be your primary language?
English.
English.
Mm-hmm.
And let's talk a little bit about your medications. What medications do you take on a daily basis?
When the pain is not too bad, when it's very mild, I'll take ibuprofen for headaches or just mild cramps. That's about 200 milligrams, and I'll take it as needed in the days I need it, probably like twice a day.
Okay.
And then when the pain is really severe, especially on my period, I'll take morphine.
Morphine, okay. Do you know the dosage for the morphine?
15 milligrams.
Okay, and how often would you say that you use the morphine?
I usually would take it on the days I need it, probably 3 times a day.
3 times a day? Okay. How do you feel your health is overall, apart from the endometriosis?
Besides that, overall pretty well.
Okay.
Yeah.
And have you ever had a history of any surgeries?
No.
Any other surgeries? No. Any broken bones?
No.
No. Are you up to date on all of your immunizations?
Yes.
Yes, okay. Let's talk a little bit about your family history. Does anybody in your family have any serious medical illnesses such as diabetes, high blood pressure, heart attack, endometriosis?
My mom actually has endometriosis also.
Okay.
Mm-hmm.
Any other major illnesses in the family?
No.
No. Let's talk a little bit about your caffeine usage. Do you drink coffee or soda?
I do. I drink coffee every morning.
Every morning?
Yes.
Okay. And how about alcohol?
Usually no, just very rarely, like on the weekends, sometimes I'll drink wine.
Okay, like a social
Yes.
drink. Okay. And then do you use any recreational drugs or tobacco?
No.
No. Have you had any recent lifestyle changes as a result of your endometriosis?
Actually, yes. I had to call in a lot for my job, saying I couldn't come in because the pain, the cramps would be really bad. So I actually got laid off from my job.
Okay.
Yeah.
I'm sorry to hear that.
That's okay.
Well, hopefully we can find some result today to do some pain management for you so that we can get you back to your normal baseline self.
Okay.
Okay. Let's talk about your female history. Do you see a gynecologist for pap smears on
Yes.
a regular basis?
Yeah.
When was your last pap smear?
Last year.
Last year.
Yeah.
Okay. And on a regular basis, do you conduct self-breast examinations?
Yes.
Okay. Very good. Talking about your safety a little bit, do you use a seatbelt in the car?
Yes.
Yes. All the time? Sometimes?
Always.
Always. Okay. If you ride a bicycle, do you wear a helmet?
Yes.
Yes. Now we're going to talk about your nutrition.
Okay.
Do you feel that your endometriosis has affected all on your eating habits?
No.
No. Do you, can you describe your eating habits to me? Do you eat 3 meals a day, 4 meals a day?
Usually 3 meals a day.
3 meals a day? Okay.
My appetite's pretty good.
You got a good appetite.
Yeah.
Okay, very good. That was my next question.
Okay.
What would you estimate your current weight as?
Around 135.
135?
Yes.
Okay. Have you had any recent weight gains or losses as a
No.
result of the illness? No? Okay. All right. And do you have any difficulty swallowing or chewing your food?
No.
No? Okay. How about your fluid intake? Talking about water intake, soda, coffee, tea, anything like that. How much do you think you drink on a daily basis?
I do try to drink like 5 to 6 glasses of water a day, and then I do up to 1 cup of coffee in the morning.
Okay,
Mhm.
all right. And do you wear dentures at all?
No.
No. Moving forward, let's talk a little bit about your elimination. When was your last bowel movement?
This morning.
This morning. Can you
Mhm.
describe it to me?
It was formed, and then it had a light brownish color.
Okay. And is that a regular bowel movement for you?
Yes.
Do you have a routine for your bowel movements? Do you have one every day, every other day?
Once a day, and then every day.
Okay,
Mhm.
very good. Do you ever experience any diarrhea or constipation?
I do experience constipation sometimes, I think because the endometriosis. Mostly though, just during my period.
Okay.
Yeah.
And when you are constipated, do you use any laxatives or aids to help you?
I try not to, but I do use laxatives, just if I really need it. I use Miralax.
Okay,
Mhm.
all right. And do you ever have any blood in your stools?
No.
No. Let's talk about your urination. Do you
Okay.
ever wake up at night with the urgency to urinate?
No.
No? Do you have any difficulty urinating?
No.
Any blood in your urine?
No.
No. Do you ever have to strain to urinate?
Mm-mm.
No. Very good. Moving forward, let's talk a little bit about your sleeping habits.
Okay.
So, on a regular night, when your pain is not that bad, how do you feel your sleeping habits are? Do you get a restful night's sleep?
Like a sound sleep.
A sound
Sleep
sleep?
the whole night through.
And how many hours of sleep do you think you get?
I try to get 8.
8 hours of sleep?
Yeah.
Okay. Now, when you're in a lot of pain, though, how do you feel your sleeping is?
A lot worse. There's some nights it's really bad. I could wake up, 3 to 4 times a night, just because the cramps, and then I try to reposition and go back to sleep.
Okay.
Mhm.
Do you ever use anything to help you fall back asleep or to stay asleep?
Little like melatonin.
Okay.
Mhm.
Okay. Very good. And how about exercise? Do you exercise on a regular basis?
Yes, I try to exercise every other day for at least an hour.
Okay. What do you like to do for exercise?
I walk, and then I play tennis sometimes.
Oh, very
Mhm.
good. Okay. The next session is a little bit lengthy, but we're going to talk about your daily functions
Okay.
and the level of your daily functions. So if you need any assistance doing anything, so it's just a couple of functions, and you just gotta tell me if you're able to do it yourself or if you need help.
Okay.
Okay. With eating, do you need any assistance eating?
No.
No. Dressing yourself?
No.
No. How about ambulation, meaning walking from your room to the bathroom, walking down the stairs?
Nope.
You're able to do that by yourself?
Yes.
Going to the bathroom?
No.
You're okay by yourself?
Yeah.
Okay. Are you able to bathe yourself?
Yes.
Are you able to wash yourself and get yourself groomed, like straightening your hair, brushing your teeth,
Mhm.
all that stuff?
Yes.
Okay. Are you able to cook your own meals?
Yes.
Okay. Are you able to do your own grocery shopping?
Yes.
Yes. Okay. How about do your own laundry?
Yes.
And then as far as your medications go, are you able to keep yourself organized and keep track of your medications on a daily basis?
Yes.
Okay.
Mhm.
And then lastly, cleaning. Are you able to clean your own house?
Yes.
Do you live in a house or an apartment?
I live in an apartment.
It's an apartment.
Mhm.
And do you live alone?
I do.
Okay. Do you have stairs or an elevator that you use?
Yes, there are stairs, but I use the elevator most of the time because I live on the 6th floor.
Oh,
so
okay.
pretty high up.
Yeah, it's a lot of flights of stairs.
Right.
Okay, very good. Moving forward, do you ever experience any muscular weakness or fatigue?
Sometimes I do feel weakness just on my sides from the cramps, and
Okay.
then the fatigue. If I don't get a good night's sleep, I'm definitely, fatigued throughout the day.
Okay, all right.
Yes.
And do you experience any swelling, redness, or warmth around your joints?
No.
No? Very good. Let's talk a little bit about your cardiac status.
Okay.
Do you have any diagnosed cardiac issues?
No.
Any history of a heart attack?
No.
High blood pressure?
No.
No? Do you have any varicose veins?
No.
No? All right. And then do you know your cholesterol level?
I do not.
We do like a complete blood panel, which might be something that you're interested in. That way you can get your levels that you know, so you know any other health issues that you need to address as far as your glucose or your cholesterol level as well. So that might be something you're interested in.
Sure.
Okay. Let's talk about your respiratory status.
Okay.
Do you have any issues breathing?
No.
Any shortness of breath?
Nope.
No? Any labored breathing at all after exercise?
No.
No. At night when you're sleeping, are you able to lay flat or do you need to prop yourself up?
Usually laying flat if there's no pain, but then throughout the night if I have to wake up, I do try to use pillows, you know.
Okay. Let's talk a little bit about your cognition and your perception. Do you have any issues with short-term or long-term memory?
No.
No? Okay. And how do you feel your decision-making skills are?
Good.
Good? Okay.
Yeah.
Very good. About your vision, do you have any issues with vision?
No.
Do you wear contacts or glasses?
Nope.
Okay. Hearing, do you have okay hearing?
Yes.
Do you wear hearing aids?
No.
And then your other senses, as far as taste, touch, smell, do you have any issues that you'd like to address there?
No.
All right. Let's talk a little bit about how you feel that endometriosis affects your self-concept as a young professional woman.
Okay. Honestly, it's just lately it's made me feel very insecure. I think because of the loss of my job. That was a big part of my life. So then the fact that that is a reason that, I got fired from my job, that's definitely had an effect on me. And then also sometimes just the pain is too much. I just want to lay in bed, not go out with friends or family. So then sometimes it's obviously like hard to meet people. Like I'm single right now.
Right.
So.
Okay.
So yeah. So I mean, it makes you feel insecure and then, sad sometimes, but just try to stay positive.
That's good. Okay. What about your current status? Are you currently seeing anybody?
No, just single.
Single, okay.
Right.
And what is your sexual orientation?
I'm straight.
Straight, okay. Do you have any history of sexually transmitted diseases?
No.
No. And are you sexually active?
I was, but not right now.
Not right now.
Right.
Okay. And when you were sexually active, did you experience any impact on your sexual function as related to your endometriosis?
It actually, sometimes it'd be really painful.
Okay.
Yeah.
Okay. And then are you on birth control at all?
No.
Have you ever been pregnant?
I have not.
Any abortions?
No.
No. Okay. Moving forward. Obviously we've addressed that the endometriosis has a great stressor is a great stressor on your life.
Right.
How do you feel you cope with the stress as far as the fears that you have related to the endometriosis, any anxiety? How do you feel you cope with that stress?
I just, I do try to stay positive. It's hard sometimes when you feel like you're always in pain and you have no other option. That's why, I've been considering the hysterectomy. The only thing with that, right now, I definitely don't foresee myself wanting to have kids, but I don't know if that could change. And obviously if I have that done, that's kind of an anxiety and fear of mine. But overall, I try to keep in contact with my family, exercise to help cope with all the stress, and just try to be positive.
Those are great coping strategies. It's really important when you're going through that much stress that you do self-care. So those are great strategies that you have to deal with what you're going through right now.
Thank you.
Okay. Obviously, I would like to talk a little bit about the pain that you experience because you experience pain on a regular basis.
Yes.
So can you describe to me on a day that the pain is really, really bad, how would you rate the pain from 0 to 10, 10 being the absolute worst that you can imagine?
Probably a 9.
A 9?
Yes.
Okay. And on an average day when the pain is not that bad, what would your pain level be?
Around a 4.
4.
Mm-hmm.
Can you describe the pain to me? Is it a stabbing, a pinching, a throbbing?
On the days it's really bad, when the cramps are really bad, just a cramping, stabbing pain. And then when it's not so bad, when it's more of a 4, it's just like, it's always there in the back of my mind, but not anything stabbing.
Okay. When it is the stabbing, severe pain,
Mm-hmm.
what location of your body do you feel that pain in?
My pelvic area and then my abdominal area.
Okay. Does it ever radiate anywhere else?
Sometimes my lower back.
Okay.
Mm-hmm.
What makes the pain worse, or what brings the pain on?
The pain is definitely the worst around my period, and then if I'm ever really exercising too hard, sometimes it'll feel worse.
Okay. All right. And how long does the pain last, usually, a bad spell of it?
Like a half hour to 40 minutes.
Okay. What do you do to make the pain better?
Just try to lay down and relax.
Do you ever use any other comfort aids, like a heating pad or ice pack or anything?
Sometimes I'll use a heating pad when I'm laying down.
Okay.
Yeah.
All right. And Alright, so we've covered all the pain, we've covered all of your baseline history. So do you have any other questions for me related to the endometriosis or anything that we've covered today?
No.
No? Okay. I know that earlier you talked about your possible interest in having hysterectomy. I think that if you would like to talk about any benefits or any drawbacks to having that, you might want me to refer you to a specialist, which I could definitely do for you. We can set up an appointment.
Yeah, that would be great.
Because it is, like you said, it's a major life decision and it will
Right.
have future implications. And that way the specialist can also go through with you any other options that you might have or be interested in.
Okay, yeah, that sounds good.
Okay, is there anything else that I can do for you right now?
Nope.
Alright, then I'll probably be back in within about an hour.
Okay.
But if you need me in the meantime, just use your call button and let me know.
Sure, sounds
Okay?
good.
Alright, thank you, Stacey. It's been a
Thank
pleasure
you.
meeting you.
Thank you.